I'm here again today with Bonny Specker, who is going to give us an update on what has been happening with COVID-19 in our region, in our nation, in our state, and around the world. And also, Bonny is going to talk to us a little bit about something, some rates that she has seen, and an article that she submitted to the Brookings Register in the past week. Bonny, what do you have for us today?
Thanks, Chelsea. The first thing I wanted to do was talk about what you just mentioned, the article and this study that came out of the CDC looking at the association between state-issued mandates and case and death growth rates. It was brought up that it was a 1%, 1.3% difference between those states that had mandates and those that didn't. So I thought I would just show what a 1% difference is. And what I did is I took the rates that were found in that paper, it's shown right here, and applied it to the Brookings County data at the time that the mask mandate went into effect. So I took the information that was from back here as far as what was happening with the new cases at that time. And then you can predict what you would expect with the no mandate. And that would be this curve here. This is the predicted number of cumulative cases, not new. I mean, it's the sum of all the cases in the past. So you can see how the cases are increasing quite rapidly here. And what these authors found is that you had a decrease of about 0.5% in the daily growth rate in the first 20 days following a mandate. And then it went up to a 1.1% decrease and then a 1.5%. And from 80 to 100 days, it was a 1.8% decrease. So the rate of change was different depending how far out you were from the mandate. But it's important to realize that we're talking about exponential growth. And that ends up being a really big effect. And it's also a daily percent difference in growth rate. So if you think of like a savings account and you have 1% interest, but it's 1% interest compounded per day, you're going to have a lot of money pretty quickly, even if it's just 1%. So this dash line here is what Brookings would have had if they implemented a mask mandate based on these numbers that the people at CDC found. And in reality, this is what occurred in Brookings over the first 100 days. So that by the end of the 100 days, there were about 2,800 cases in Brookings. And what the model that the CDC used, they said we'd have about 4,000 cases if we had a mandate put into place. If we didn't have a mandate, we would have had 15,000 cases. So roughly 13,000 more cases than what we actually observed if that mandate had not been put into place, based on these estimates that came out of the CDC. If you look at South Dakota, so I took what was going on in South Dakota the week before the date of the Brookings mandate, and this solid line is what's predicted if you didn't have a mask mandate. These dots are what was actually observed. So you can see that South Dakota as a state pretty much followed the predicted line with no mandate, maybe higher here, but at the end of the 100 days, it was very similar. And what the model was saying is that if you had a mask mandate in the state, there would have only been 24,000 cases rather than the 91 to 93,000. So by not having a mandate, there were about 70,000 additional cases in South Dakota that could have been prevented. So I think that it's good that the mask mandate is continuing in Brookings. As you'll see from the data that of this past week, there's some things that are of concern locally, and we'll get to that now. Here are the weekly data. So these are the number of cases by week as of today. And you can see that Brookings over the last month has started to increase. And this is what we call, what looks like it's starting to be an exponential curve, you know, that it's really starting to take off. So hopefully this will get tamped down. Some of this could have been from the spring break. And if that's true, we would expect things to calm down in the near future. We did have 62 cases last week. This compares to 42 the week before. So you can see that's a pretty big 50% increase in just 1 week. There have been a total of 3,734 cases in Brookings as of today. So we are back into that substantial spread as well. If you look at who tested positive this past week, it's kind of all over the board in a way. We had, you know, if you look at it as a percent increase, the big percents were in the 30 to 39 and the 60 to 69 age group, where you had 14 and 8 cases respectively. But we also had 15 new cases in that 20 to 29 year age group, even though it's just a 1% increase. And we also had 11 cases down here in the 10 to 19-year-old age group. The 40 to 49, there were 8, so quite a few cases in a variety of ages, but none in this 70 plus group, which is just great. I think this has been 4 weeks now that we haven't had any new cases in this group that is very vulnerable to adverse effects. So that's a really good sign that it's staying away from them. But this group is also vulnerable, so that's a group that we need to worry about. This is a group that vaccinations are now open to, so this I'm hoping will go back down. As far as hospitalizations, we only had 1 of them this past week compared to 5 in the previous week. And we didn't have any deaths, likely because we don't have those cases in that 70 plus group. If you look at statewide, the state is actually increasing too, but it's not really that curving up that you see with Brookings County. There were 40% more cases this week. We have 1,400 cases, where compared to 1,000 the week before. So the state is in substantial spread. If you look at hospitalizations, there's currently 72 people hospitalized, and that's this blue line here. It's starting to come back up just a tad. The total hospital admissions are close to 6,900. And for this past week, the total admissions are less than what they were the week before. So we had 73 admissions this week compared to 84 the week before. And that's these purplish vertical bars are the number of new admissions by week. And this yellow one is the number of people in the ICU. This actually increased from 10 last week up to 17 this week. So even though the number of hospitalizations went down, the number in the ICU has increased. As far as deaths, this is still holding steady at around 10 deaths per week. There have been 1,924 deaths in South Dakota since the pandemic began. If you look at the vaccination data, Brookings County, 27% have received at least 1 vaccine, or at least 1 dose, and 13% are fully vaccinated. If you look at the state, that's 32% and 20%. And this is for just residents age 16 and up. because they aren't vaccinating children yet under the age of 16. Typically, there are some that are being vaccinated, but I think they're the very high risk children.
Now those second dose clinics for the pod are coming up. So
Right,
there'll be
right.
two more pods coming up for individuals to get their second doses that have already gotten that. So hopefully that number
Oh,
will
next week that should
go up.
really be up quite a bit, because that pod for the first pod is getting their second vaccine tomorrow.
Mm-hmm.
So here, if you look at the percent of the population getting at least one vaccine by age, you do see that strong relationship with age, mainly because the pod or the vaccines were originally targeting these higher risk age groups. 51% of individuals aged 60 to 69 in South Dakota have been vaccinated. Again, we expect these percentages to increase. And as I mentioned, they're only vaccinating those above 16, and those haven't started yet unless you have high risk. So the people down here that are being vaccinated are likely to be maybe children that have some sort of immune issues going on that are higher risk than the general population would be. Also, this particular slide, the percentages are different because this also includes the veterans data as well as Indian Health Services. If you look at the population that's positive, that's tested positive by age, these blue lines are Brookings County and the yellow lines are the state. And you can see that we have a smaller percent of the population that is tested positive across all age groups. And, perhaps this could be from the mask mandate. I mean, you can't really say for sure, but it makes sense that a county that has had a mask mandate for the largest city in that county would have fewer positive cases. So it's consistent with that. If you look at the United States, so we're here, the United States is actually looking pretty good overall. We have decreased again. Last week, there were 430,000 new cases, and we're down to about 405 new ones. So for a total of 30 million or 30.6 million cases. The deaths have also dropped quite a bit, and we're at 556,000 cases. This week there have been 7,500, and last week there were close to 8,800. So this is continuing to drop, which is good. Globally, it's looking a lot different. We have 3.5 million new cases this past week compared to 3.1 million the week before. So you can see this is increasing quite consistently over the last month and a half. If you look at deaths worldwide, we're also seeing increases there. This past week, there were 63,000 deaths worldwide compared to close to 61,000 the week before. And I wanted to just summarize a couple things. What's not shown on this graph, but shown on the cumulative death graph that's included in the slides that you post, there are now more Americans that have died from COVID than died in both world wars combined. And I think that people really have a hard time comprehending that. I know I have a hard time comprehending just the magnitude of that. Last week, South Dakota ranked 21st in terms of the highest number of cases in the last 7 days, which is pretty good. This week, however, they've moved up to 12th. So we are seeing this increase relative to the rest of the country. And cases are on the rise. And I thought this graph, or picture, graphics, I guess, shows it really well, this is new cases, not mu, but new cases in the last 7 days regionally. So these circles represent a certain number of new cases, and the bigger the circle, the bigger the number of cases. And you can see that Minneapolis over to Eastern, this whole area right here is getting hit pretty hard right now in terms of new cases, and we are right in here somewhere. You know, Denver, the western side of South Dakota, North Dakota, northern Minnesota, they're doing pretty good, but there seems to be this localized outbreak in this general area that's going on this past week. Hopefully that isn't that UK variant that can be transmitted very easily, that has been found in Minnesota along with the other two main variants. The South African one and the Brazilian one are both been seen in Minnesota, and the UK variant has been detected in South Dakota, but hopefully this is not going to lead to more of those variants. The test positivity is running high both in the state and Brookings County. South Dakota currently has the highest test positivity in the country out of all 50 states. US cases and deaths are trending down, but globally they're increasing. And I think it's important for people to realize how important that it is that we don't want that to happen. You can say, well, it's not the, the US, let them worry about themselves. But the problem is the more people worldwide that you have with this virus, the more likely that you're going to have variants that may not respond to the vaccine, that may mutate and become more dangerous. So it really is important for the vaccine to get out there worldwide. So anything the US can do to help with that, I think is really a great move. So that's all for this week. Do you have any questions?
I don't, Bonnie, but thank you so much for that update. It's disappointing to see what the cases that are on the rise, but it's good to have the information and know what's happening. So I encourage individuals to continue to practice measures recommended by the CDC. And if you have any questions for Bonnie related to epidemiology, make sure you email us at that email address that's located in the description of this video, and we will get that back to you. So have a great week and stay safe.
And Chelsea, I just want to add something in here.
Yeah.
That there is a light at the end of the tunnel now. We just might be hitting bumps in that road along the way. And hopefully this is a small bump, what's happening now, and not a big bump. So I'll just throw that out there so I'm not being a real downer this week.
Well, thank you, Bonnie.